I'm Dr. Freddy Gomez, and this is Medtalk, your weekly on-air health consultation here on CNN Philippines. Pope John Paul II and former President Cory Aquino both died from colorectal cancer. Colorectal cancer is among the top 5 most common cancers in the Philippines today, according to a study. It is a cancer of the large intestine or colon, the lower part of the digestive system. Doctors know that it occurs when healthy cells in the colon become altered. Many people with colorectal cancer experience no symptoms in its early stages, so regular screening, living and eating healthy is important, especially if you're from a family with history of the disease. Our guest for today is Dr. Rami Rojas. He's the clinical director of the Colorectal Clinic and the chairman of the Department of Surgery at the Medical City. March is Colorectal Awareness Month.
Yes.
And what better way to celebrate this is to talk about colorectal cancer. So let's start first, doctor. What is the colon and where is it exactly in our body?
Well, the colon is the last part of our intestines. It's where our stools form. And after the colon, the rectum stores the stools and lets it out at an appropriate time. So there's a lot of bacteria in the rectum, there's a lot of things going on there. And because of that, it's one of the areas in our digestive tract that has a propensity to have a lot of problems, especially colorectal cancer.
And how does colorectal cancer start?
Well, it starts as a mutation of one of the linings of the colon wall. We call it the mucosa. It starts forming into a polyp, which is an abnormal growth, but it's not yet a cancer. And the polyp, if allowed to continue and grow, eventually becomes a cancer, and that's where problems begin.
Is colorectal cancer common, especially here in the Philippines?
It's one of the most common cancers in the world. It's number 3 in the world. It's, in our last count, it was number 4 in the Philippines, but it's playing between 3 and 4 in the Philippines. Across Asia, it can be number 1 in some countries, like in Singapore and Malaysia. So as a country develops economically, as people get older, the risk of colorectal cancer increases. So it's going to be, over the next 20 years, still one of the most common cancers that can strike our population.
Okay, definitely on the rise. So how does colon cancer pretty much begin? So like what you mentioned, it starts out as a polyp, correct?
Yes, that's right.
So as a polyp, is there any signs and symptoms that one might...
Well, you may be lucky if you have some bleeding. That's usually the early signs. But many people with polyps don't even know it. They're asymptomatic. They're walking around healthy. And yet, these polyps will continue to grow. And over many years, actually almost 10 years, that's when they start becoming cancers. So we advocate screening for colorectal cancer because screening is done on healthy people. So even if you're not feeling anything at age 50, we want you to get screened because if we pick up something, we're hoping it's still a polyp. It hasn't developed yet into a cancer.
Okay. Are all polyps the same, doctor?
No. There are what we call pre-malignant polyps. These are the ones that can become cancer. There are also polyps that are not pre-malignant. So we still remove all polyps through the colonoscope, but it depends on what comes out in pathology. If it's a pre-malignant type, that's the one we start monitoring more frequently.
So definitely important factor here is to have yourself screened, definitely. So we want to see those polyps early.
Right.
Early,
right.
Okay. Is there any type of staging for these kinds of colorectal cancer?
Well, it's the basic stage 1 to 4, being stage 1 being the earliest, stage 4 being the latest, where it has spread to all over the body, in many organs, particularly the liver and the lungs. So stage 1 is the earliest. It's very shallow, it's very superficial, very curable. In fact, it's one of the most curable cancers. Stage 2, a little deeper. Stage 3, it has started to spread a little in the lymph nodes, but not yet to the whole body. So there are different phases of the way it spreads or it grows. And each one requires sometimes a different treatment. So it's very important for us clinicians to really stage our patients well.
Can anyone get colorectal cancer, or is there a certain age group who is more at risk for developing this?
As long as you're aging, your risk for colorectal cancer increases. So people who are above 50 years of age, in fact, 85% of the people who get colorectal cancer don't have a family history. They just have, we call it sporadic. They just aged. Maybe their diet had a role in it, their lifestyle, but certainly age is the most important. 15% are genetic, or it's a family thing, or some mutation. So these are the people who get colorectal cancer at a younger age, less than 40 sometimes. So we need to understand that. Now, what makes you say you have a strong family history? If you've had two or more relatives, direct relatives with colorectal cancer. And in that situation, we screen them earlier.
Okay, so two or more relatives who are affected by this,
Yes.
Definitely
You may have a family history.
Okay, all right. Are there any things that one should watch out for, like with regards to food, with regards to
Well,
diet?
we do recommend a high fiber diet, lots of vegetables and fruit, because that makes the colon move better. So it expels potentially carcinogenic material out faster. We we try to avoid red meat, processed food, refined food like barbecue. You know, the oling in barbecue. Excuse me, and even canned goods have been associated with that. Hot dogs, for instance, but. Generally,
is there anything in particular about these processed meats, these canned foods, particularly important with colorectal cancer?
Well, you know, if you look at the development in countries, you know, as a country develops, the food becomes more refined, more fast food maybe, but definitely more ingredients we mix with the food. So these developed countries have a higher incidence of colorectal cancer. Even so, no, if you're a vegetarian, as long as you're age 50, that doesn't make you immune from colorectal cancer. You do have to get screened also.
Okay, definitely very interesting, doctor. But before we continue further, we have to pause for a quick break. Don't go away. You're watching Med Talk here on CNN Philippines. We'll be right back. Did you know that a colonoscope is a thin, long, flexible camera lens with a light at the end which is used to view the walls of your intestines and rectum? It is designed to move freely with hardly any friction, thus giving little to no discomfort to the patient. Welcome back to Med Talk. Doctor, let's talk about again the symptoms and the signs that one might experience to make them think that they might have a problem with their colon or their rectum.
Okay, I mentioned bleeding. If you have bleeding as you move your bowels, do not associate that with hemorrhoids automatically. Get checked. A change in bowel habits. You can be regular and then suddenly you have more constipation or alternating diarrhea and constipation. That's one of the things you watch out for. Unexplained weight loss. You're not dieting and yet you're losing weight. Anemia. People are wondering, why are you pale? And you check your blood, you're anemic. That might be also one of the symptoms. Pain. If you've got pain, frequent pain or colic.
What kind of pain is usually
This is the
experienced?
kind of pain where it turns around, like you want to move your bowels and then it doesn't go away rather quickly. These are things that you watch out for. But you know, we want to avoid people reaching the symptom phase. We want to pick them up where there are no symptoms, because the higher chance for cure or prevention is there. So screening is done on people who are not feeling anything. If you're feeling one of these symptoms, you're not going to get a screening test. You're going to get a diagnostic test to find out why you have these symptoms. Okay.
I see. Okay. And once you get diagnosed, let's say...
Well, the diagnostic test is a colonoscopy. If you're feeling one of those symptoms,
okay.
you get a colonoscopy to find out.
Okay. Is there a difference, doctor, between colon cancer and colorectal cancer?
The colon is the last part of the intestines just before it reaches the rectum. The rectum is just before the anus. So anatomically, there's a difference. The first part, longer part, is the colon. The last part is the rectum. But as you're putting your scope in, you actually don't see the difference. You just know at one part it's the rectum. As you go higher, it's the colon. For most people, there may not be any difference in symptoms or slight difference, but for doctors, practitioners in colorectal cancer like me, there's a big difference. The way we treat colon cancer is different than the way we treat rectal cancer. Rectal cancer may be a little more aggressive than colon cancer, and therefore we are a little more aggressive in our treatment of rectal cancer also.
Okay. Yeah. And going back, doctor, to the foods, I'm quite curious. How does, like you mentioned earlier, like the barbecue and all these food, how does this contribute to colorectal cancer?
The theory is this: some of them are carcinogenic.
Okay.
You put them in contact with the cells in your intestines. They may result in causing a mutation of the cells. Okay, so if you eat one of these carcinogenic foods, then you may be predisposed to that. However, if you eat a lot more vegetables and fruits, that one has been proven also. An interesting fact, you know, our colon anatomically looks more like the colon of a cow than any other animal.
Okay.
Meaning our colons were made to have more fiber. And if you eat the fiber, the colon starts moving better. So if you ate something that may have been carcinogenic, it passes out faster, and you're therefore less exposed to it as you move it out.
Aside from a diet which might predispose someone to colorectal cancer, is there any other
smoking?
Okay.
Alcohol, diabetes, lack of exercise, lifestyle. Right. Obesity, these are things that may predispose. But even if you look healthy, and this is one of the things I always feel sad about when I have an elderly patient, 80 years old maybe, no diabetes, no hypertension, and they come to me because of colorectal cancer. I feel bad because if they had been screened, they would have not had the colorectal cancer. So irrespective of your lifestyle, irrespective whether you're a healthy looking individual, you should get screened.
Okay. And just to touch on, how does the screening process take place, doctor?
Most people will say colonoscopy, which is the most accurate. You put a scope in, as you mentioned, take a look. If you see a polyp, you can remove it through the scope, not a surgical procedure. If you see a tumor, you'd biopsy it to see whether it's a cancer or not. But there's another screening test that is actually very effective and cheap and actually works in huge communities. It's called fecal occult blood. They just check your stools for microscopic blood. And only if it's positive do you get a colonoscopy. But you do that every year, though. A colonoscopy, if it's normal, it can be good for as long as 10 years.
Wow.
So I had a colonoscopy.
Okay, okay, that's
I didn't want to worry about anything else.
There's definitely nothing to be afraid of. Nothing to be afraid of. Pain-wise, is there any discomfort?
We usually prefer patients to be asleep. So you sleep very nicely. When you wake up, it's done.
Yeah, that's awesome. So definitely, it's important to get checked. Yeah. Definitely important to get screened. You mentioned also about certain lifestyles that must be avoided, and one of these is excessive drinking and
alcohol intake. Alcohol intake and smoking.
Okay, so all of these contribute definitely to the predisposition to colorectal cancer. Yes. Now, once someone is diagnosed with colorectal cancer, what are the treatment options?
Well, the most important treatment option is surgery. Okay. For almost all stages, surgery is a treatment option, and I'm a surgeon, so there are many types of surgery that can be done, but the trend really is to move towards less invasive, so less smaller wounds, laparoscopic through cameras, and even robotic surgery for rectal cancer. It's more precise in movement. We also are moving into more enhanced recovery, so sending home patients earlier and faster. But other than surgery, particularly for the later stages, which can still be curable, for instance, stage 3 can still be curable, they do involve other modalities like chemotherapy, for rectal cancer, chemotherapy and radiotherapy, and then, of course, an overall treatment, nutritional program, an exercise program. In fact, what we're advocating now is more a team approach and a program for colorectal cancer rather than individual doctors doing their own thing.
Okay, we'll definitely get into that a little bit more, doctor, especially the treatment part.
Yeah.
But we have to take another short break. We'll be right back. Stay tuned. Here are some myths and facts about colorectal cancer. It's not true that there's nothing you can do about getting colorectal cancer. Colorectal cancer may be preventable. A diet low in fat and high in vegetables and fruits, as well as exercise, may reduce your risk. Second, is colorectal cancer fatal? No, it is curable when detected early. A large number of patients with localized colorectal cancer are still alive after 5 years after diagnosis. And third, screening is necessary, especially for individuals who have no symptoms. Since early colorectal cancer often has no symptoms, it is important to obtain regular screenings to detect these cancers. Talk to your colorectal surgeon or other healthcare professional about when you should begin screening. Okay, doctor, let's talk more about the treatment with regards to colorectal cancer. Are there any programs that you'd like to tell our audience?
Well, first of all, these cancers should be handled by a multidisciplinary team. A surgeon, a medical oncologist, a radiation oncologist, they should be planning things together because that actually gives better outcomes. And patients are able to plot out what they're going to go through. We don't like it that a patient moves from one doctor to another only to realize he has to go through this and all. We want to plot out everything because the treatment can be complex. The other thing is there are advances in each of our specialties. Surgery has advances in minimally invasive, robotics. Chemotherapy has also progressed and is making people live longer. Radiotherapy, there are newer machines that give very targeted therapy. Putting all this together in the team, we also have what we call an enhanced recovery after surgery program. It's coming in from Europe and spreading through all over the world now, where we really take care of the patients before surgery, during and after, to make sure that they have less pain, that they recover faster. And so we're starting at that. It's called ERAS, Enhanced Recovery After Surgery, and it's something we're trying to promote all over the country now.
Okay, that sounds very comprehensive. Now, with that much involved with the treatment of colorectal cancer, let's talk about cost a little bit. Is this type of treatment available even for our brothers and sisters who are not as fortunate?
I'm glad you asked that, Freddie, because the treatment can be expensive because there's so many modalities you may have to go through. So the PhilHealth has actually developed a Z-benefit program, particularly for the indigent patients we have in our government hospitals, where everything is provided for free. Okay. Whether it's chemotherapy, surgery, radiotherapy. The most important thing, and you know, I helped work out that program, the most important thing is before treatment, the team gets together and approves the program. So no individual can decide on his own that I'm just going to move on to surgery. I'm just going to move in. The whole team decides together, and then the patient is enrolled. So that's what we're very excited about. It's the team approach to how we treat our patients, particularly in our less privileged compatriots in the Philippines.
Is this available?
Well, it just started.
Okay.
So government hospitals, one by one, are enrolling in it. The Philippine General Hospital has started. Some government hospitals have already applied. We actually have a workshop for those who want to avail of being part of this program for doctors.
Does this Z program,
Z-benefit, yeah.
Z-benefit program include even the screening part, the colonoscopy part?
As soon as you're diagnosed, that's when we start the program starts. Screening is a different thing. Okay. Screening is done on people who are not sick. And PhilHealth has a different program for that.
And is the screening process affordable as well?
It is affordable because if you just choose fecal occult blood, which costs a couple of $100 only once a year, that's effective already. Of course, colonoscopy can cost anywhere from $10,000 to $20,000, but even that is affordable because if you think about it, if you're normal, you don't need another one for the next 10 years. Okay. Well, I always say colorectal cancer is one of the most preventable and the most curable. It's preventable by screening. If you're age 50 or above, you get screened, please. It doesn't have to be a colonoscopy, although that is the best test. You can get fecal occult blood testing. And then do not worry about costs. Many of our government programs and even our private hospital programs are now also going to get involved with the Z-benefit package. So there's a lot of options for patients right now. It's important to see, though, an expert. It's also important to make sure your experts are working as a team.
Okay, doctor, do you have any last advices for our audience or any tips for prevention?
Prevention, eat healthy, high fiber, less fat, less red meat, less canned meat, exercise, avoid smoking, avoid too much alcohol. If you are over 50 or if you have symptoms, just see your gastroenterologist or your primary care physician and talk about screening.
There you go. Screening is definitely important. Thank you again, Dr. Rami Rojas, for all those very important tips. Unfortunately, that's all we have time for today. See you again next Thursday, 9:30 p.m. here on Medtalk, your weekly on-air health consultation here on CNN Philippines. I am Dr. Freddy Gomez. Thank you for watching.